All right, looks like we have everybody's just signing in now, and we'll pop up the presentation so it's available. Good morning, Rob.
Good morning.
Good morning. Everybody's popping in now. We're almost there.
What's that?
So everybody keeps hopping in. We're slowly getting to our whole crew.
Morning, everyone.
Good morning, sir. How are you?
Good.
Are the kids getting used to their school back, everybody? Everybody kind of getting used to this whole fall experience so far? A little different? How's Anthony about with it, Akram?
Andrew is okay. Yeah, he just started on Tuesday. But the college kids already back to the to their college. Actually, Ann is in college and Anthony is working now.
Right. I meant to say Andrew. I'm sorry. It's
Yeah.
hard with all the A's, you know. You kind of made it difficult for us.
Too many A's.
Morning, everybody.
Morning, Dan. I actually just popped up the presentation, but you can. I'll stop share, and then you could put it in when you're ready.
That's totally fine. Yeah, I think actually Anthony leads us off with the enrollment call.
Okay.
Yeah.
I just meant for you to pop up the presentation on your screen as opposed to mine. Or just kind of give you that.
Yeah, that's fine. I could do that right now if you need it.
Can't believe I forgot my webcam at the office.
It's all right. We don't mind. You know, there's a gentleman on here in the meantime that has been on the calls for the last 2 days, and I think he's worthy of. I think it would be important to just introduce him to the crew. You'll see this gentleman is the only person in our organization in our over 40 years of presenting awards, and we have one award that we call the Leadership Award. And basically this award is given to the person who represents leadership in all facets of their business. This gentleman actually won he's the only person in the history of Diversified to have won the Leadership Award 2 times. And I haven't even heard his voice. So once he comes off mute, I want to introduce him to each of you, because I think you'll find you can learn a great deal from him. He still hasn't unmuted himself, so I'm just going to wait. But I think each of us could learn a lot from his leadership ability, from his he's still not coming off mute.
I'm Jeff.
Oh, there we go. Good morning, sir. How are you?
Welcome, Doug.
It's good to hear your voice sort of. Mr. Jeffrey Arroyo, he's a winner of 2 leadership awards with Diversified, President's Eagle Award, the Bulldog Award. We've been working with Jeff for a very, very long time. He actually has not stepped into the Medicare Advantage arena in this capacity yet. So this will be his first year in on the phone. And I'm just saying, watch out, guys, because you're about to see somebody kill it. And you'll see that you'll just experience it, not only from his personal production, but I think what he's able to offer everybody on this call in his sales experience and the way he goes about his business. I think we're all going to benefit. So welcome, Jeff.
Thank you so much, Mike, for the kind words. I appreciate it. Good morning, guys. I think I can. I'm probably going to learn a lot more from this panel than you guys will from me.
Great to have you on board, buddy.
Thank
Welcome back.
Yes, it is. Yes,
All
it
right,
is.
then you're good with the PowerPoint?
I'm sorry, did you say Dan? Yeah, I'm up. I'm ready. Yeah, it's fine. Let's do it.
All right. Well, I hope everybody had a great evening. I hope we did not overwhelm you with information. Well, I kind of hope we did overwhelm you with information, but then again, I hope we didn't. Hope it was you're able to absorb it okay. It was a lot. We get it. Like I mentioned yesterday, it's definitely something that it'll start to flow for you. The more you do it, the more it starts to flow. We tell everyone when they get on our calls. And by the way, we have conference calls every Tuesday and Thursday evening, of which it's basically just the telesales people that are on the conference calls. And we just kind of go through a list of, what happened today and what could we help you with, and, what was the situation. And everybody kind of learns from each other. They're usually about an hour long, sometimes a little less than an hour. We try to cap it at an hour, actually. But they, one of the things that we always say over and over again is when people start talking about, well, I had this one and the doctor just wasn't in the network, or I couldn't find a special election period, or whatever it might be. What we seem to find is we say, well, what happened on the next call? Because it looks like you only made 7 phone calls today. And they say, well, yeah, that is kind of the case. And it's, well, if we don't have the numbers in play, you didn't play the numbers game the right way. You got to play the numbers game so that we could really talk about what's happening. And what we found is the more phone calls you make, the more people you speak to, the more experience you get, the better you get at it. And it all comes down to just being able to make more phone calls. So whenever you have any doubt about what you're doing, just stop and say, did I make the phone calls? And a lot of times you're going to say, you know what? No, I didn't. I didn't make enough phone calls. So just kind of remember that, and I'm not even going to say the back of your head. It's the front of your head. Remember, you gotta talk to the people. If you don't talk to them, you're not going to get anywhere.
So Anthony, how about this? How about you inspire us and tell us what somebody is doing to be fantastic at this, both in terms of calls and success per day?
So it's interesting because when you start out, you're going to start out and it's going to take you about 60 to 70 phone calls to have a sale. Okay. That's going to be in your first week. By your second week, you will be right at about 40 phone calls per sale. And then we have a bunch of people at this point that have gotten so much smoother in it that they're anywhere from 13 to 17 phone calls per sale, which is not a lot of calls. They've just gotten better at what they're saying and how they're handling people. So if you want to judge it, I'm trying to simplify. Obviously, there's lots of different formulas, whether we're talking about closing rates or whether we're talking about, but to simplify it, look at the number of phone calls you make. It'll only take you a couple of weeks till all of a sudden you're somewhere between 13 and 17 phone calls per sale. That's not to say that tomorrow you're not going to have a bad day and not be able to get anybody on the phone, and it was 100 phone calls, but the following day you make 3 phone calls and it's 3 sales. Talking about an average over a weekly basis, you can get yourself down to that 13 to 17. And there's, and I'm not talking about one person. We have a bunch of people that's the scenario that they're in.
Great, thanks.
You got it. You got it. Miss Moore, good morning to you. Is she there? Is she?
Good morning, everybody. Sorry.
How are you?
I'm great. How are you?
Outstanding. Outstanding. And we're even better now that we hear your voice. So, one of the things that I always like to turn over to you to do and explain is the introduction. Guys, we're at the point now where the person has called you back on that inbound call, and when they call you back on the inbound call, it's you're going to get somewhat formal. You have to go through this script, and you have to go through it basically verbatim because it's all being recorded. One of the things that Nicole stands very strongly by, or does, and I stand very strongly behind her, is she likes to tell people, this is what we're going to do, then we're going to do it, and then we're going to tell them what we just did. So she wants to prep them up front for exactly what is going to happen. Now, although this is a CMS-approved script, this very first paragraph was not filed with CMS. This part was a Nicole thing of telling people exactly what's going to happen. And it's important that you do this and do this part right, because if not, you're going to get a bunch of confusion in the middle of doing the enrollment itself on how they should answer certain questions. So, Nick, let me turn it over to you to kind of get rolling on what happens when that person calls in.
So once the person calls back, like Anthony said, I basically tell them what's going to happen, how the enrollment process goes, the part that they're going to play in the enrollment process, and so that there's no objections, right? Or hardly any. And that the objections are already taken care of before we start the enrollment. Once you start the enrollment, you really don't want to go back to selling or doing things that you were supposed to do in the sales process because you are reading this script verbatim. You're not making a friend. You're not doing any of that. It's basically you sticking to the script, reading everything verbatim, and you want to prep them for that. So I basically just walk them through the enrollment process. I let them know how long it's going to take, what they need to say, what questions I'm going to ask, some of the disclosures and things of that nature. So, Anthony, did you want me to just read through this here, or?
If you could just do at least that first beginning paragraph part.
Okay.
You wrote it.
Okay. So, now, Mrs. Jones, before I begin the enrollment, let me just explain how the enrollment process goes so you know what to expect. I'll start the recording by reintroducing myself. I'll let you know that the call is being monitored and recorded for quality assurance, and I'll ask you for permission to continue. Okay, once you give me permission to continue, I'll ask you to confirm if you place the call in. I'm going to ask if you're completing this application for yourself or for someone else. You'll answer accordingly, and then I'll be asking a series of questions. Now, these questions, they will determine why you are eligible for these benefits at this time of year. Of course, during AEP, you don't really have to go, you don't have to go through the questions, so you're going to adjust that accordingly. You'll answer yes or no to each question. Once we get to the question, whatever their SEP is, in this case, do you have both Medicare and Medicaid? You'll answer yes, and this will enable me to move forward with the enrollment. I'm going to be reading through a bunch of disclosures, some of which does not pertain to you. However, these disclosures have to be read on every single recording that I do. Now, there's going to be something in there about a late enrollment penalty. This is for people who did not enroll in a prescription plan at the time of enrolling in their Medicare Parts A and B. However, you have your WellCare prescription plan, so that's not applicable to you. All right. I'm going to talk about a premium and ways to pay it. This, again, is not applicable to you because this plan does not have a premium. Now, if the plan is an LIS plan or low income subsidy plan or a plan with a premium, of course, you're going to address that, okay? Some plans, like for instance, this plan has a premium of $14.10. However, you have what is called a low income subsidy at a level 1 at 100%. So that premium will be zero for you. Okay. Remember, it's a zero premium plan. By default, what WellCare, the WellCare system will do, they're going to generate a coupon book for you. That coupon book will say $0 on it. So when we get to that part of the enrollment, please respond coupon book. Okay. Now, if there's something that I read that you quite don't understand, please feel free to stop me and we'll go over it. I'll conclude the recording with a confirmation number for you to write down and keep for your records, and you'll have your benefits by October 1st. Okay. Like I said, you just basically let them know what you're going to do. It eliminates objections. It answers all the questions up front. It tells them what part they're going to play in it. So even after reading these long and tedious disclosures, they're already prepared for that. They know what they need to answer and when. Okay, so it just makes everything run smoothly.
Awesome. Awesome. Any questions on this at all, guys? Okay. All right. Thanks, Nick. So now this is an inbound call that you just received. If this was a call that was being transferred to you, which is not really happening, that's when you do this first paragraph. But we always like to say, you know, who you are when you start anyway. So, okay, Mrs. Jones, we're going to get started. As we move to the enrollment portion of the call, I'd like to remind you this call is being monitored and recorded for quality assurance. Do I have your permission to continue recording? We realize that you've already asked them that in the sales script, but this is a different call, so you have to ask it again. Next page, please. Okay. So we know that you've already spoken. They've already spoken to someone. So now it's Mrs. Jones. You called into me in order to complete the enrollment portion of this call. I will be entering information for. It is important that you do this right here because this is the part where you're actually saying this is the plan you're applying for, Mrs. Jones. So you have to say, I'll be entering the information for the WellCare PPO, DSNP, whatever the name of the plan is, including the network type, whether it's an HMO, a PPO, whatever it might be, with a premium of $0 through Diversified Health. Now, if you are enrolling somebody in an LIS member into a plan that has a premium, even though the premium may be covered for them, you have to say with a premium of $3.22 in the event that were to happen. But you have to say that even though it's going to be subsidized for them by the government. Now, with a premium amount of $0 through Diversified Health, do you wish to apply for this plan? You must get a yes or no. You cannot just get You have to get a yes or a no for them. Now, will you confirm that you placed this call to Diversified Health? Yes. Now we go forward. Now, again, if they say no, again, this thing maps you out to if no state due to the laws, I'm not allowed to take an application from an outbound call. But you know all of this already, guys. You shouldn't be at that point that a person would say no, and it's, when you ask, will you confirm that they've placed it? So now, Diversified Health is a licensed and certified representative of WellCare and may be compensated when enrolling you into this plan. In order to process your telephonic enrollment today, a licensed sales agent must not be present with you. Besides me, is another licensed sales agent physically with you or on the phone now? Again, CMS requirement, something that you have to ask the question. You have to obviously hear no. Next slide, please. Now, are you completing this application for yourself or on behalf of someone else? Here's your map. If the caller is completing it for themselves and during AEP, just go right to step 11. If it is outside of AEP, which would be in the next few weeks, then you just have to continue to the next steps. If they are doing it for if they're doing it for someone else, if they're power of attorney or whatever it might be, you go to step 7, you go to step 8. Again, if it's outside of AEP, you're going to go to step 9. Again, you just have to kind of follow the map. If we are outside of AEP, all right, then here is our step 9. Oops, you're right there. You're outside of, this is your step 9. So typically you may enroll in a Medicare Advantage plan only during the annual enrollment period from October 15th to December 7th of each year. Now, Mr. Jones, there are exceptions that may allow you to enroll in a Medicare Advantage plan outside of this period. I'm going to ask you some questions to see if we can establish an enrollment period for you. Please respond with a yes or no if any of them apply to you. By stating yes to any of the following, you are certifying that to the best of your knowledge, you are eligible for that enrollment period. If later we determine this information is incorrect, you may be disenrolled. Now, it's important. I explained to you yesterday that we're going to the question to determine their eligibility based on the information that they gave us, not reading every question. For the enrollment script, you have to think about this as if this was an application that was in front of them for filling out. So if that application was in front of them that they were filling out, they'd be reading down every question to mark no or mark yes. You have to go through every question, even if you already know that it's the 10th question on here. You still have to go through every question and they should be answering it. Are you new to Medicare? Are you enrolled in an MA plan and want to make a change during the Medicare Advantage open enrollment period? Now, that's your question that you're going to be asking on January 2nd, or January 1st, rather, to the end of March, because that's our AEP period. So more than likely, when we're in OEP, we're going to be stopping at the second question. Have you recently moved? Have you been released? Again, just go down the questions. The one that you're going to really utilize outside of AEP is, do you have both Medicare and Medicaid, or is your state helping to pay for Medicare premiums, or do you get extra help paying for your Medicare prescription drug coverage, but you haven't had a change? That's going to be your duals. That's going to be your LIS. You would have already gotten this information through app or on the iPad, or on the Ascend app, rather. But that's the one that you're going to hear yes. When you get a yes to the question, to any of these questions, you can stop asking the questions at that point. You don't then need to continue through the list, but you got to start at the top and work your way down. Here's some more of them. Are you leaving an employer plan? Do you have a pharmacy assistance program? That's going to be your EPIC or your PAD programs. Weather-related emergency, that's what we were talking about yesterday for the special enrollment. Were you enrolled in a special needs plan but have lost a special needs qualification to that plan? Again, you get the questions, guys. It's just like an application of what you're accustomed to filling out, but you got to start from the top and go all the way down. Once you establish that an SEP is there, you go to step 10. Based on our conversation and the eligibility period identified, you are eligible for the repeat the plan again, WellCare Value HMO. and your proposed effective date is, and here's our planned start date. Now, no different than the field, I gotta remind you, it's the first of the following month every time, even if it's the last day of the month. It's the first of the following month. Just because today is the 31st doesn't mean you could say, Mrs. Jones, let's not make it effective tomorrow. We'll make it the first of the following month because you have a doctor's appointment. It doesn't work like that. And it's either going to get rejected or it's going to give them the effective date of the following day. And then you're going to have a CMS complaint issue. Except during open enrollment. Obviously, during open enrollment, we're talking about January 1st. Now, we know you know their name. We know you have all their information. Please state your full name, but you got to do this. Step 11. Please state your full name as it appears on your red, white, and blue Medicare card. Please state your date of birth. Please state your sex. You are inputting all this information into the computer as you're doing this. May I please have your telephone number? Would you like to provide an alternate contact? Would you like to provide an email address? You're agreeing to receive emails from WellCare. You can opt in and out. May I have your address, please? May I have your complete permanent home address, including city, state, zip code? Again, just like a paper app, PO box is not permitted. If you have a mailing address that's different, would you like to provide an emergency contact? May I have your Medicare number shown on your red, white, and blue card? Repeat it back to them to confirm the accuracy of data. Obviously, this is important. You need to be entitled to Medicare Part A and be enrolled in Part B to enroll in this plan. May I have your Part A and Part B effective dates as they appear on your card? Now, this portion of the script is where we start to get, it gets a little confusing the first few times you do it. And again, I like to utilize the word map. Okay, if you let this thing map you on where you're going to go, you're going to see that it works fine. But if HMO, PPO, or SNP, continue to step 13 from there. If no, if PFFS, you're going to go to step 14. We're not doing any private fee for service right now. If you were doing just a PDP plan, after you get that Medicare number, you're actually skipping that first paragraph and going to, you must have Medicare Part A or Part B to enroll in this plan. I have the Part A and or Part B effective dates. Because remember, for a PDP plan, you don't need to have both. You only need to have one or the other. Go ahead to the next slide. Okay. Now, this is what I was talking about with the mapping. You see at the beginning in italics, it says for HMO, PPO, or SNP, MA, MAPD plan. This is where you're going to read. If you were doing a Part D only plan, then you would actually be skipping this and going to the next section, but we won't go there yet. So make sure, this is what I was saying yesterday about printing this out in color, because it tells you in black or in italics where you're supposed to be going. So if enrolling in a health plan with a 0 monthly premium, then that's the paragraph you're going to read. If you're doing a plan with a monthly premium, then you read the second paragraph. But either way, for all of the plans, whether there's a monthly premium or no monthly premium, you are going to read the third paragraph. Is everybody with me? Give me a little yay.
Yep.
Yes.
Okay. All right, we're getting there. Now, this is where Nicole was referring to earlier about the premium payment option. Please select the premium payment option, Social Security, Railroad, or get a coupon book. If you coach them the right way, they're going to say coupon book right there. If for some reason they said Social Security or Railroad retirement, then you need to read the next paragraph. But if not, next slide. You go to the one that says if coupon book. You may also pay your premiums by credit card. or by deduction from your bank account instead of using to set up your payment, visit our website. Now, if you explain it to them the right way, they're going to understand that there is no premium payment, or how it would work for them. The next section, again, comes down to the mapping. It says for PFFS MAPD plan. We're not doing private fee for services right now. If you did do a private fee for service, then you would go here instead of the first part. But 99.9% of the time, you're not going here. So you're skipping section 14 right now. If you were doing just a PDP plan, you would go to section 15. But you're not doing that. So we're skipping all of section 15 and we're going to section 16. So this is what I meant when I said the script is long and it gets scary sometimes, but you're not reading the whole script. It's a map of if this, do this, if that, do that. So now you're at 16. Do you have end-stage renal disease? As I mentioned yesterday, there is a good chance that this is coming out of the script.
Better come out of it.
What's that? It better come out of it, right? The only thing.
Did you hear me?
Reason why
I'm sorry.
No, I heard you. You know, the only thing that I'm saying it should come out of the script and not it's coming out of the script is that I'm wondering if from an understanding, I would imagine it's part of the health risk assessment, okay? But because the carrier needs to know what they're dealing with, they're going to get reimbursed at a different rate if a person has ESRD. But I'm wondering if, because it's so hard for a carrier to get a hold of people a lot of times for the health risk assessment, I'm wondering if this is still going to stay in the script just so that they understand or know if a person has end stage. But we'll find that out. We'll find that out very soon. Some individuals may have other drug coverage, including private insurance. Now, this is where it matters, PA benefits or SPAPs, State Pharmaceutical Assistance Programs. So you will ask them that. If they have it, like an Epic or a PAD or whatever, you want to make sure you get that information because obviously that's going to be what determines their drug cost. What's the name of the other coverage? Next slide. What is your ID number for this coverage? What is the policy group number for this coverage? Do you live in a long-term care facility but not an assisted? If they say yes, you're going to go right to step 20. If they say no, you're going to go to step 21 for a Medicare Advantage plan. If it was just a PDP, you'd go to step 24. What's the institution name? You currently enrolled in a Medicaid program. Does your spouse work? Again, follow the map. Would you like to provide me with the name of your primary care physician? Now, keep in mind that you've done all the work already on this. You've already had the conversation with them about who their doctor is going to be. This is not the first time that you're having the conversation of, you know, the PCP you selected is not a part of this plan. Would you like me to help you select another? You should have done that already and explain to them exactly what the primary care physician is that you're going to utilize here. If they say, I don't want to give you a doctor, I don't care what doctor, then you say, if you need a PCP and do not choose one now, the plan may select one for you, but you can change doctors at any time by calling the plan. Next slide. If available, would you like to receive your plan information in language other than English or in an accessible format? Which language would you prefer? If no, just continue. Would you like to receive your plan materials in large print? If yes, just do that on the application. Now you're at step 25. Mrs. Jones, I'd like to review the information we just collected. Now you've received everything, you've already put it in the application, and you are going to review all the fields that you populated during the application process. First name, middle name, last name, date of birth, all these things. After you're done, you say, is this correct? If they say no, what do we need to correct? If they say yes, go to step 26. If you intentionally provide false information on this application, you will be disenrolled from the plan. Do you certify that this information provided in this application is accurate? Get a yes from them. We need to go through some important plan information. Again, the map, guys. Which one are you using here in 27? Is it a PFFS? Is it an MAPD? Is it an MA or is it a PDP? Again, most of the time you're just going to step number 29. But this is the map. It tells you where to go. So here's our step 29. You currently have health coverage from employer or union. Joining a WellCare plan could affect your employer or union health benefits. You could lose your employer or union health coverage if you join WellCare. Read the communications your employer or union sends you. If you have any questions, visit their website or contact the office listed in their communications. If there isn't any information on whom to contact, call your benefits administrator or the office that answers questions about your coverage. Go to step number 30. Follow the map. Read the black. By completing this telephonic enrollment application, you agree to the following. WellCare is an HMO. The D-SNPs have contract with Medicaid. It's your responsibility to inform the plan of any prescription drug coverage you may have or may get in the future. If it is an MA-only plan, which most of the time you're not doing, you read this. If not, continue reading for all plans. Enrollment in this plan is generally the entire year. Once you enroll, you may leave this plan or make changes under special circumstances. Now, if it is a PPO plan, you have to read if a PPO plan. If non-PPO plan, then you read the non-PPO plan. Just remember, your headings are the black. Continue reading for all MA, MAPD plans. Services authorized by WellCare, other services contained in your WellCare, evidence of coverage. Next slide. Will be covered without authorization, either Medicare, no. Again, you read this whole thing. Go to step 32. You understand that your verbal signature or the verbal signature of the person authorized to act on your behalf under the laws of the state where you live on this application means that you understand the contents of this application. Please state, I agree. This is huge, guys. This is the signature. If they don't say, I agree, the application cannot continue unless you state that you agree. Do you agree with the statements that I've just read to you? If so, please state, I agree. And then again, if they don't agree, you have to go to step number 37, so on and so forth. If they are a POA, you have to go to step number 33. If it is the actual beneficiary, you're going to now go to step 34. Next. You have completed an application for the WellCare Value Plan HMO. From WellCare on, you say today's date. This completes the Medicare Advantage prescription drug portion of your enrollment. Now, I'm going to give you the WellCare confirmation code and ask that you write it down. Please let me know when you are ready. At this point, guys, you hit submit, and after you've hit submit, it'll go through and you'll get this confirmation number. The confirmation number is your application is being submitted to WellCare, who will submit it to Medicare for approval. Now, you giving this confirmation number is the nail in the coffin here. It's the final step here of, yes, this is like you giving a copy of the application to them if you were sitting in the house, okay? If for some reason you were unable to get that confirmation number, you're going to have to explain to them that you need to give them a call back to give them that confirmation number, and that'll also have to be recorded. It's huge. It's very important here. If your enrollment application is approved, they will mail you your new insurance card and your evidence of coverage within 10 days. Should they require additional information, you'll be contacted by phone or mail. If it's determined you're not eligible, a letter will be mailed to you. If you have any questions, here's the number. Complete your application. Now, where you say thank you, again, you have my contact information. It's been a pleasure speaking with you. Your closure portion, but you are actually done with the enrollment at this point and at this time. That is our inbound enrollment script. So let's go. Let's hit some questions. And I'm going to let Nicole answer most of the questions because she's done this a lot more times than me. But so let's go to the script portion only as far as questions go.
This is Brenda. I have a question.
Okay.
In the end, where it says they will get their information within 10 business days, is that applicable with AEP as well? From 10/15 through, 12/7 that was just my case, because sometimes with AEP they don't normally get it within 10 business days. So that's the only thing I was just asking.
Yeah, I'm with you. So I believe they're supposed to get some sort of acknowledgement within that 10 days, even during AEP. It may not be the membership card and everything else, but I believe they get an acknowledgement of the application. And I think that's a CMS requirement. Because this is the CMS script, I'd say we stick with that. But I get your question, and no, they're not getting their kit in 10 days. I mean, I'm being as honest as I could. During AEP, they're not getting their kit in 10 days. Unless something drastically has changed, which it may have, I would say that they're going to get some sort of notification within 10 days that it's been received.
Okay, thank you.
Great question. Great question.
Anthony, hi, this is Jackie Altman.
Hi.
So I understand that at the end of number 10 and the beginning of number 11, it's when we're literally taking their information and keying that information into the online enrollment tool. Is that right?
That is correct.
Now, all the information that is on the script, is this the exact same information that's in the, that's in the enrollment tool?
Okay. So it is all the same information that's in the enrollment tool. However, we remember we were explaining that we moved over to a new app, to the Ascend app, first the previous platform we were using. The new platform is not in the same order as the script. So you may have to jump around a couple of fields here and there. We anticipate the new script would be in the same order that's coming out. But as of right now, it is not in the same exact order. However, this is the application as far as all of the questions, and like nothing is missing or is changed or anything like that. It's just the order is not necessarily in the exact order.
And I'm just trying to make a determination as to whether or not to read directly from the script or directly from the enrollment tool. Do you want us to read from the script?
When you were doing the inbound enrollment, you must read the script. You have to. It's as if you were sitting. It's as if you are the application that they're filling out. So you have to read the script that way.
Okay.
Okay.
Hey everybody, this is
And
Dan.
I promise you it'll get smooth. I promise you it will.
Just wanted to add one quick second to that. That's going to be something that we actively listen to as well. As we kind of talked about yesterday, we have the luxury in our phone system to kind of listen in and follow procedure and make sure that things are going pretty well. And some of Nicole's responsibility on day to day is coaching you through those challenges. So usually she's, without even you knowing, she's actually listening in. She may actually say, "Hey, Jackie, just want to know you're doing great, but you missed step 11. So if you don't mind, before you continue, if you could just jump in and say this one specific line." And then as you get more comfortable, that steps away. In addition to that, we actually have Jeanette, who is on the line, and you'll get to know her a little bit. You'll hear from her in a second. But after you do your recording, she's giving it a call as well as you're getting up and running and operating. And then you'll see some of the challenges that may or may not come across. And so usually the first question here, and I was going to jump in right after Anthony was done. Usually the first question, I'm shocked it hasn't happened. I know someone's thinking it. Usually the first question is, how long does this entire thing take? And the answer would be the first call, the sales call, is generally between 25 and 30 minutes. And then your very first enrollment call is usually between 28 and 34 minutes. But that's just your first one. After you get the hang of it, probably 2, 3, 4 in, you're down to between 15 and 18 minutes for an enrollment call. So we listen actively to kind of wrap those up.
I have a question, please. This is Jackie Carter. Could you clarify the script situation? Isn't the script in the enrollment tool?
No,
It's not.
no.
Okay.
So the script, if you were just a field agent who was taking a application via electronically, where you were sending out for signature, or where they were calling into your iPad or something along those lines, and you had a scope of appointment, then there are different steps for the script. This is different than anything that the field agent side does, where it's, I want to say there's more freedom, but I'm careful in using it that way. It's more trust of, we are WellCare. We're taking the enrollment as if we are WellCare. So we're inputting directly into their system, which is different than, you have different access than what an agent has when they're out in the field. Does that make sense?
Are you still there?
Yep.
Okay.
So that's the reasoning that, so the script itself is going to be something you definitely want to print out and have sitting in front of you. Make one less screen that you have to look at as you're doing it, because you're already going through enough inputting things in.
So as you're reading the script, you're inputting the information into the enrollment tool on another screen. I mean, the enrollment tool is on your screen, and you're reading
Correct.
the script, and you have to put the information that the client is giving you into the enrollment tool. Is that the process?
Correct. That is correct. And everybody says, holy crap, talk about multitasking when they first start. But it gets
Okay, may I
moving.
ask, why isn't the script embedded into the enrollment tool?
Because it's a different system that you're on. It's not something that they've made. They've made it so that we kind of have the freedom to say, ideally speaking, you're talking about if it's a PPO, why doesn't it go to this disclaimer for the PPO? Or why doesn't the screen go to that portion of it? Or why? We have more freedom than to have to follow it that way, that we're able to kind of.
So this is different from Salesforce, and this is different from Connecture?
Absolutely.
Oh,
Absolutely
okay.
positive.
All right. Gotcha.
Absolutely positive. You know what? That's a great way to put it. When you're doing a Salesforce or a Connecture or whatever, that is your generic system that's going to have multiple carriers in there that say, for this carrier, do this, and for that carrier, do this. And then from there, it goes through a middleman process, and then it goes into the carrier.
Uh-huh.
We think about it as if we are WellCare. We are doing an enrollment directly into WellCare system. So that's the reason why you're not dealing with where there's multiple scripts where it pops up. And so now I get your question. Now I understand where you're coming from on your question.
Okay.
Think about it as we are WellCare. We are going right into their system. And that's the reason why there's no fancy scripting coming up on the screen first based on which carrier it is or so on and so forth. Does that clarify it?
Yeah, that clarified it for me. Thank you. Appreciate it.
The question you're asking is actually a great question. The way that I'm looking at it, and I know Nicole is as well, it's actually, what you're saying would be great to have, but the way we have it is actually a luxury, because we're able to have a real conversation with our friend, not our client. you know, the person that we're really getting to know, sometimes in the sales script, things get a little out of order, right? Sometimes you may not be at the point of saying, you know, are you on Medicaid? Person may tell you they're on Medicaid, but you're not there yet. It makes it the continuity of having a conversation freer instead of say this now, do this now. Oh, you didn't say this part, you're going to get a slap on your wrist. So it kind of gives us a little more freedom to get to know the client the way they need it, both on the sales script and on the enrollment script.
Right. Right. Okay. Any other questions on the script itself and the inbound portion of the script? Everyone feels good and comfortable? Okay.
Yeah.
Yeah. Okay. Dan, what'd you have? What's the next slide?
So next is going to be taking into, sorry, just a little far back. It's going to be going through the doctors and drugs and things like that. So let me just get there. Okay, so at this point, we went through what to say and how to say it, but there's a couple steps, as you guys know from the field, that you have to go through. Some of those are checking drugs, checking doctors, knowing which plan to present. So what I'm going to do is I'm going to take you right through the WellCare website, and we're going to go through all three of those right now. After we go through all three of those, I'm going to start how we take an application with the Ascend platform, the site that Anthony was mentioning where all this data goes into. And that's going to be when Jeanette kind of helps me out and kind of goes through the exact website. But let's start with the doctor. These are the steps. This is all on our website. I think you may have seen it on our screen already. The div.com/telesales. And then you just can click on any of these links. I'll tell you exactly where you're going. But just for the sake of seeing it, let's go here. Sorry for switching back to my screens. But you're going to go right to wellcare.com. And when wellcare.com comes up, you're going to just click on whatever state you're in. I happen to be in northern New Jersey, so I'm going to go to New Jersey. And then when you're on their site, you click on Find a Provider in Pharmacy. And what I like to do is always, whenever a doctor is given to me over the phone, one thing I don't want to go by their spelling. I don't want to go by their address. I always like to Google it. So I actually looked up my doctor specifically, just to give you an example. His name is Agresti, and he's in Nutley. Now, sometimes you'll get the doctor's name. Sometimes you get the doctor's address. They'll know the building number. They'll know the phone number, something like that. Everybody's come across different situations. But I always like to know exactly where there is and position myself as the expert. So when they say Agresti in Nutley, okay, great, I see him. He's on 181 Franklin Avenue, right? All right, great. So what I want to do is I want to take this zip code, and assuming I'm talking to somebody on the, I'm looking for a D-SNP plan, I can go zip code, enter right in, and then look up by keyword. If I was looking up maybe an internist or a gastroenterologist or ear, nose, and throat, whatever the specialty is, I can look it up that way, as well as the provider name. In this case, I'm going to look up Agresti. Obviously, just click go to results. And he populates right here. Shows that he's in the network. It gives me the WellCare provider ID. And one thing I always like to do is, and we'll get there, is keep that right in my notes. So for argument's sake, whenever when you send your notes in to Jeanette, which we'll get to in the after sale procedure, it's all right there. What may happen is 5 to 6 months down the road, if there is a complaint, which doesn't happen very often, but if they do come through, and they say the doctor wasn't in network, we'll be able to provide to them the provider ID that we got right from the website. In some cases, I actually encourage agents to print this page out with it right on their wellcare.com website to show that they were in the network at this time. The date will be right on the printout, and then you submit that as well. Doctor procedure is pretty easy. I'll go back to a fine search. You can see it one more time. You could look it up by address, zip code, the county, or the city and the state. All different ways, and sometimes you even have to look it up by plan. So for argument's sake, if you get that far and you know that they're going to be dual eligible, you look it up under the dual plan. If it sounds like they're more of an LIS type of person and you happen to know the specific state that you're in and you know that the LIS plan is the RX HMO, you look it up under that plan. Okay, so that's the doctor lookup. Moving along, if you have any questions about the doctor, I could stop now. Otherwise, we're going to jump into the summary of benefits. Okay, cool. So you're at the point of the presentation where you need to know kind of what plan to present. You know that they you got them. You know you can help them. They have a need for you to make a tailored solution to them. What plan do you present? Right on the WellCare website, and this is as it is for 2020. This may change in the next 6 to 8 weeks, depending on how we get into open enrollment on how we get to it. And we'll put out some, something so you know how to pull all the summary of benefits. Right on the wellcare.com. Again, I'm gonna do the same state here. Click on New Jersey. Right here it says I'm looking for a plan. You click Need a Plan. I'm seeking a Medicare plan near, and I'll use my hometown zip code 07960, which is Morristown, New Jersey. And it tells you the 3 plans that are in Morristown. Sorry, yeah, in Morristown, in my county. So I just click. I don't go complete plans and enroll. I ignore this side of it. The reason I do that, that'll actually take me right through to Medicare's website. We don't need that right now. We just want to know what the plan benefits are, the explanation of benefits, whatever the premiums are, co-pays, et cetera, et cetera. So I want to click on, I want to learn more about this plan. And right here is a list of the PDFs, specifically summary of benefits. You can do it in a few languages. And then it'll download for you, open it up. Summary of benefits in New Jersey, Liberty, in these specific counties for 2020. And then, sorry, it's being a little fast, hope it's not glitching on the screen there. You go through everything here. This one's try different. Let me show you a different plan just so it's not on the wrong direction. Compass. That's more easy to read. Tells you straight through exactly which plan you're looking at, whether value or compass, what your plan premium would be, your deductible, maximum out of pocket. You're going through all of these specs right down the line. In-hospital coverage, outpatient coverage, ambulatory doctor visits, $5 and 40% if you're out of network because it's a POS. Any preventative care, 0, etc. right down the line. Pretty straightforward for all the different states, all the different counties. It's going to be, I'll go through it one more time. Right on the site, the state that you're in, need a plan. Medicare, you're going to skip Medicaid. Specific WellCare states have Medicare only plans. So we're going to go Medicare. And then let's use this one right here, 33477, just happens to be in my cookies. All the zip codes, all the plans available in that zip code in Florida. All right. Anything about the doctors or the summary benefits so far? Okay, cool.
This is Dominique. Can you replay the steps on the website? So you click the state.
Sure. I'm sorry. For the summary benefits or for the doctor?
No, the benefits, the plans.
Sure. Yeah, no worries. So right on the top, you can go to wellcare.com. Show you one more time. And then whatever state it is, and I think I see there your tag is Florida, so we'll put Florida in right there.
Right there.
Okay, because you're going to click Need a Plan right here.
Wait.
Okay. And then I am seeking a Medicare plan, and that zip code that we use is 33477.
My page doesn't look that way. 1 second.
No worries, take your time.
Florida. Oh, did you click on Need a Plan?
Yeah, right on the left corner there. Just for some reason, Florida is just a little different than the New Jersey one. It was on the left side of New Jersey, but Florida was right up on the left corner.
Okay, so okay, now I see okay. It said skip Medicaid, go to Medicare, type in the zip.
That's right. Yeah. And then whatever one works in that county, whatever one may be the best fit for the client based on the conversation that you have. There's other resources that we can share if to let you know to help you along that process. someone who's become really good at the different products in the various states. Nicole, she's kind of a great resource for you. And in the states that she doesn't know, she's really good at learning them kind of on the fly. So that's one option.
Got it. Thank you.
So that's the summary of benefits. The next one I'm going to do is going to be the doctors. It's going to be the drugs. And for the drugs, I like to use just an app. There is a website that's available, a few different sites through wellcare.com. And as Ascend improves, you're probably going to be able to look up the drugs right in the Ascend platform. However, the best app that I found is called Coverage Search. And I'm going to kind of walk you through. I will put these links in the chat as soon as I stop my screen share because it's only allowing me to share the mic right now. But I'll share these two links, and then I suggest if you work on an Apple or a iPad or an iPhone platform, download this link. You can actually go right through and check the drugs. If you have an Android, I have that one up as well. I'll share that link. You can download it, and essentially all you have to do is just enter the drug. If you can see the screen right on it, you enter the drug on the top line where the star is. You tell them what state you're in, and then obviously you have to list it for Medicare. It'll tell you exactly what it's preferred with WellCare. If you click on that caret, which is a picture of a screen, it'll tell you which tier it's in specifically. So these two apps, one's on an Android platform. I know some of you guys use that platform, and then the other one is the Apple. So those two links I'll share in the chat. As soon as I stop my screen share, it'll allow me to share to everybody. Let me see if I can do it. Actually, Mike, if you wouldn't mind, it's only allowing me to share to you. Can you copy and paste those to the group?
Sure.
All right, great. So those are the first three of my steps. Let me just check my presentation here. So we did doctor lookup, summary of benefits. We'll get to the portal next. Prescriptions we did. Great. So Jeanette, if you're on, I'm going to ask you to come unmuted here.
I'm here.
All right, great. Do you want to control the PDF or would you like me to?
I can do it.
Okay, great. So you can take the screen over. I'll stop my share. So Jeanette, I'll talk about it for a second here. So essentially the website is going to be, it's going to be right. Actually, it's in the PDF. I'll let you handle that part of it, okay? So the next step is going to be Jeanette. She's going to come on. She's going to walk you through what we do when we get the enrollment as far as where we enter all the information into. So hang on one second.
That's the screen you're looking for. So you're going to use the website that I believe, Dan, are you sending them?
We could actually put it right in the chat here. Let me get that. I'll send it over to Mike. And Mike, if you could just share it with the group, that's fine.
So you're going to use your email and the password that was provided, which I believe is the WellCare123 with a capital W. And
So
you're going to...
Sorry, Jeanette. So that email is going to be whatever email you've been using with WellCare on your contracting. So if you contracted a year ago or 6 months ago or just a couple days ago, whatever it may be, whatever email address you got your contracting in is going to be the one that you have. I know these days usually people have 2 to 7 different email addresses, and that always comes up as some point of challenge, but it's going to be the contracting one.
When you log in the first time, it will prompt you to change your password. Okay. So on the Ascend platform, there is something as a blue button. Now the blue button would take the client right to Medicare.gov, but since we are going to enroll them now, we can just skip that portion, and you're going to click no, I prefer to enter my information manually. Right. We're going to skip through this because you already went through the medications with the member.
As I said, this can all be done through the Ascend platform. I just personally like having the phone in the hand. I think that app is the app I shared, Mike shared for you guys. It's just so much more fluent that it's just easier to use.
Dan, it on the platform, it doesn't necessarily show you if it's a network yet.
Okay, so that's probably something they're shooting for October 1. So perfect.
Okay. Now you are able to do the extra help eligibility check on this platform. After you put in the zip code and you skip over to number 5, which is our plans, it'll ask you about the eligibility. And if you want to check the eligibility, then you click yes. You are also able to skip this and click no. Okay, if you're checking eligibility, it'll bring you to the screen. You need to fill out the member's first name, last name, date of birth, Medicare number, and either the Medicaid number or their Social Security number. It will not allow you to check the eligibility without one or the other. Okay, then you would check status. Okay. It does give you the option to look at plans on this platform as well. So you would choose which plan you are enrolling them into and hit apply now. You are also able to view the details of the plan on this platform. And it'll come up with a summary of benefits. You can click apply now, or you can go back to quotes. It also gives you the option to compare plans as well. Okay. Once you put in the zip code, you are able to skip steps 2, 3, and 4 and just go right to our plans, which is number 5. Okay. Once you click number 5, it's going to bring you to the eligibility check. And then once you do the eligibility check, it'll bring you to the information screen of the beneficiary. You're going to fill out the first name, last name, gender, date of birth, email address if they have it, phone number, and alternate phone number. If you see on the bottom here, you have the option to save the application. There is also a button for send for signature. As a telesales agent, we do not need to use this. This is for agents that are working out in the field. They are able to get a signature that way. You would click next. Then it asks for the address. You will fill out the address. If a mailing address is different than the permanent resident address, then you're going to click the button here and check it off so that it gives you the spaces to write the mailing address. Then you would click next. Emergency contact. You would fill in the emergency contact information here. Once you start typing, you would need to fill out all of these boxes and then click next. This is where it is asking you for the doctor. Now for this platform, they are asking for you to put in the doctor's NPI number. There is a provider lookup where you are able to find the doctor's NPI number, but you have to make sure that once you find the doctor on the provider lookup that you add the doctor and save it, or if not, it won't generate the doctor into these boxes. It does ask if the member is a current patient as well. And you're going to hit next. If you do the eligibility check, the Medicare number and the Part A and B effective dates will automatically be filled in. If you do not do the eligibility check, you can fill out the Medicare number, Part A and B effective dates, and then hit verify. It'll verify the Medicare number right there. And then you would hit next. This is where it's asking for the election period. For AEP, I believe there will be the option that is the open enrollment period. They do have the option, I am newly eligible for Medicare, and this is my first entitlement to enrollment. I am newly eligible for Medicare Part D, prescription drug coverage, or my situation falls under one of the special election period circumstances. And once you click drop down a list of special election periods. Then you would choose one and hit next.
Sorry, for AEP, which one do we choose?
You're going to wind up doing probably my situation falls under one of the special election period circumstances. And it'll give you the option that it was in AEP, that you're in the open enrollment period.
There actually may also be an option, because it's an electronic platform, it may actually unlock on October 15th for you to actually put the application as a checkbox then, and it may just then lock up again on December 7th, but we'll see that and how that works out.
Okay. This is where it is asking you the health questions, the ESRD question, the long-term care facility, Medicaid. If the member does have Medicaid, you are going to have to put in the Medicaid number on this screen. Do you or your spouse work? It also asks for the language preference and if the member wants their information in large print down here. Then you would click next. This is where they have all the disclosures that we do have on the enrollment script as well. And this is where you would put in the applicant's name for the signature and the date. It also asks if they're enrolling for themselves or on behalf of someone else. If they are the POA or authorized rep, you would click the bottom one and it'll have you fill out the information of the power of attorney or authorized rep. Then you would click next. This is where you pick the payment plan and you have the electronic funds transfer, deduction from monthly benefits, or send me a coupon book. Okay, and you would choose one of those and then click next. And this is where you are able to review the application. If there's any information that is incorrect, you are able to edit that portion. And if everything is correct, you would hit apply now. And this is where you get your confirmation number, which would be in bold over here on the right side. And then you would be able to print the application and save it as a PDF and then email it to myself and Dan. Okay. And that's pretty much the enrollment.
Okay, great. Any thoughts, any questions about how the platform will operate?
So to have access to this, there was a link, I guess, at the front. Can you email that to us or
That link is actually right in the chat. And that link probably won't work if you haven't done the 5 steps that we kind of discussed yesterday, making sure that here, I'll put them up on the screen again. In order for that link to work, share my screen.
Oh, I see the well care. I got it. Yeah.
That's going to have to stop sharing her screen in order for you to.
Hold on.
Is that
One.
it?
Oh, go ahead.
In order for that link to work, these 5 steps must have happened. Contracted with WellCare, completed AHIP certification, completed WellCare U, or the certification for 2021. WellCare's University is what they called it in 2020. You've gotten a ready to sell, and then you're at the point of fit step where you're creating a telesales login.
Great.
Yeah, I just want to mention one more thing.
Sure.
Just make sure that you are logged in and your email address or your name is on the top left-hand side. If your name is not on there, then you will not get credit for that application.
Would you repeat that?
Sorry about that. I'll show you exactly what I mean. Jeanette, why don't you take the screen back and you show us there? For some reason, it's just not showing.
Hold on.
I think the link may have just timed out because I had it open for so long.
So Ascend does time you out. You want to make sure that your name is in this area or your email address, however it is logged in. If your name does not appear here and you submit an application, you will not get credit for that application.
So if your name is not there, what should we
In this
do?
area.
So for argument's sake, let's just say, just like in your bank account or your credit card or your mortgage website, whatever one you go to pay any of those bills are, where if you were to open up the site, sit on it for 5 to 10 minutes, step away, go grab a cup of coffee or a snack in the kitchen, come back and there's the notification that says you are about to log out for 10 to 15 minutes of inactivity. Click here to stay logged in, what have you. A message like that pops up, and if you ignore that message and right where it has that name there, M. Betaniglia, whatever it may be, Beni's, whatever it is, if that disappears and there's nothing there, you're not entering it into the credit for you specifically. You're just entering it into the WellCare system, and you won't get the credit for it. However, it's just like your bank account. It's just like your mortgage company. It tells you what's happening. So as long as you're not just sitting there leaving it actively open and you're ignoring that message, there should not be a problem with this. Since we rolled this out about a month ago, maybe a little less, three to 4 weeks ago, we haven't had any of the challenges. I haven't even heard the phone ring about this. It's just something that we like to share just so that you are aware.
Is there a test site or a sandbox where we can practice?
There are companies that have that. Mutual is great at having that. WellCare does not have one of those. One of the things that we practice, we could share this PDF with you though. Jeanette, I think you have this PDF. We could probably save it and get it posted on the Telesales site, and you could just walk through all the slides. We'll probably make it up on the site where it has one of these important resources.
Okay, thanks.
No worries.
One thing I just want to point out is that at this point, there's nobody on the call is ready to get that login for the telesales side. Whether it's that the steps were not done or the contracting department at WellCare is behind, whatever the reason is, at this point, nobody is actually set to have that login into this. Hoping by next week, that's a totally different story.
And I would just confirm that we are updated. Yesterday's training day is going to be up online on the div.com/telesales, ready for you by within a couple hours or so. She's working on it as we speak. And this recording will also be there. And we will be parsing out the Ascend portion of this so that if you just want to watch the Ascend section and just get that information, you'll be able to watch that as well. So it'll all be made available to you through the div.com/telesales.
Could you
Who do we reach?
put that in chat, please? The
Got it. Yeah, I'm literally typing as we speak.
Okay,
Additionally, you'll also have Centene, the recording from Monday, where it went through all the different products. That site will also have all of those recordings broken out by states, so you can look at that as well. She's literally, I just spoke with her a couple minutes ago. She's putting it up there right now, so you'll be able to use these sites to go back to, and all of the stuff will be made available to you on your own time as well.
So,
Mike, on that topic, Mike, can you also ask her to replace the PowerPoint presentation with this one that's on that site?
I'm already working on it, but
Awesome, thanks.
I just have one thing. Jeanette started off, did you not start off with finding out or verifying the LIS on this app, on this platform?
Yes. So when you
did change over to the enrollment, that's where I got lost, I think.
So you are able to check the eligibility on this one.
I'll do it later. You don't. I thought I
That's
was.
the first thing. When after you put in the zip code, it'll bring you to checking the eligibility.
Oh, okay. And suppose, all right, if they don't have their card and they don't have their Medicaid number, so we would not be able to use this, correct? Or
Not on the platform, but you are able to still get that information from SPOP.
I thought you could put in social security number.
You are able to.
Oh, okay. All right.
So as long as they have that, you should be able to check. Is that correct?
Yes. Yes.
Who do we reach out to if we think we're completely done with everything? Hello?
Dominica would probably be the best route to go if that's the case.
Okay, yeah, because I think I've done everything. This is Jackie. I think I'm done.
Jackie, I think that is true. Some of you are just waiting to be switched over to Telesales. So if you do reach out to Dominica, just stay in touch with her. And I will also ask her to just do a follow-up with everybody. Some of this is just as simple as the internal with Centene, just making you ready to sell on the phone.
Okay, and then one last question. On that app that Anthony was talking about, the coverage search, MMIT, can that be opened up on your PC or not?
Oh, so great question. At one point, it was available, and something happened. They must have been on to us because they made you have to register, and it's actually only used for providers. So if you're an MD or any type of doctor, you may be able to use it, maybe get a registration. I tried to register ourselves because we used it for a long time, and then all of a sudden we got locked out. So you can't use it on that platform. I would suggest if you have a a phone in front of you or an iPad in front of you, just download it to one of those platforms, and then hopefully Ascend will have it all set for AEP starting on 10/1.
And that is strictly for the drug search, correct?
Yes, ma'am. That's correct.
All right, thank you.
You got it.
Hey there, this is Brenda. Just logistically, when we are calling, am I going to be doing it from my computer? Because I use my iPad for everything. I have all my apps when I'm out in the field. That's how I sign my clients up on my iPad. But if we're calling and doing everything over the computer, then I can use my iPad for the other stuff I need in front of me. I'm just curious how logistically the phone calls are going to be. Are they going to be through like Vonage and Mobile Connect?
Oh, actually, we're going there next.
Oh, sorry. I'm sorry.
Perfect. You actually gave us an entree. As long as we kind of closed
Nice
out.
segue.
Yeah, it's perfect spot for us to move on to the next spot. So, I'm actually going to share my screen in a second. Okay, you're good, right, Dan? Before I want to make sure we're good.
Yeah, I think so. I think there's one more slide for me later on, but we go through, I think, your couple slides, leads, things like that, and then we come back to me for commission conversation, which I know everyone's ears will be openly, intently listening to that part of it. So I think otherwise you're all good.
Okay, great. So I'm gonna share my screen then. PowerPoint. Here we go. And all right, so you have to bear with us a little bit because some of this is going to be what we are currently doing, and then we are going to be hopefully within the next 2 weeks changing most of these processes. So forgive us. We want to make sure that you know exactly what we are doing and not speak in terms of the fairy world, if you will, of what we want to happen. So I'm just going to go at it exactly the way we're doing things today. But it is our goal, and I'm just prefacing this, that all of this goes away and there's a much simpler process, which, you know, Jacqueline, you spoke about Connecture or Salesforce, or Brenda, you brought up different options as well. We are going down the path of being able to take on those types of models in order to work, which are much more efficient. But you guys have to remember, we were really a field organization first with a small call center, and it worked perfectly for our call center. But when COVID hit, we were provided with the opportunity to be able to present this to our agents. And we've been working in that realm at this point with using what we did work with in inside office and with a small call center mentality and pushing it out. And we're finding that we have better ways to do this, and we're trying to improve those that efficiency before AEP comes. So we're making strides, but we are not there yet. So I'm not ready to present that portion to you. So I'm going to tell you exactly what we do today. Essentially, we use Google Sheets. We send out a Google Sheets list of all of the leads that you're going to be using that you have, other PDP leads. You go right into your Google Sheet. When you open it with your Google Sheet, if you don't have a Google account attached to, or your email address is not attached to Google, we ask you to do so. Just go in, you could sign up with Google. If you have like a Yahoo account or you use any other account, you can attach that to Google, and it will allow you to open any Google files that are sent to you. Once you do that, generally what will happen is that, you'll see this yellow column here. This yellow column, basically, when you click on the down arrow next to it, it will open up different options for you to choose for a disposition. All we really care about is being able to disposition that lead so we can get it back into Salesforce and be able to let Centene know that that's what occurred with that lead, and we move on to the next one. So whether that's with an appointment that we've booked for you, we need you to disposition those and get them back to Jeanette every day. If it's a matter of just in your Google Sheet that we're sending out to you and you're dialing away, we ask you to just choose one of the options within the disposition, and it'll populate on a monthly basis. We'll be able to pull it from there. As far as what a disposition is, this is pretty simple and straightforward, but we don't want to just spend some time here. Obviously, a sale means that you enrolled the person. If they're not interested, it's not a final answer. I can tell you that just because they're not interested in you doesn't mean they're not interested in somebody else. No, maybe it was just a bad day, maybe it was a bad timing. So we don't final answer that lead. It actually goes back into Centene, and Centene will push it back to us at some point in the future. Wrong number. With our population and our marketplace, a wrong number could be a wrong number today, but tomorrow they pay for the phone again and they're back in service. So it's important that you do mark the wrong numbers, because we start to research them in a different way and we try to get those right numbers. But letting us know makes a big difference. Once again, it's not a final answer though. So sometimes you will receive it back in the future and it's back on again, and it happens all the time. Call during AEP. This makes it available during AEP. Obviously, most of you will be working for AEP, so this is obviously not a disposition you'll be using, but a lot of these are happening right now where agents will go in, sit with the person, and when they sit with them, they'll find that they are eligible during AEP, so that's when we come back to it. left message, and I would say also that you want to ask for permission to call that person back during AEP. There's no reason for you not to be able to talk to that person. As long as you get permission, we can go back and pull that call, and we can attach it to that lead so that when you make the sale, you can use that person still. But you have to ask for permission to call back during AEP. And I would personally suggest that, if those are the circumstances, I would be reaching back out to those people in September, touching them as many times as I can before AEP to make sure that that conversation is not lost. And because they're going to talk to other people in the meantime, there's going to be other conversations that they have. If you know that their doctor is in network, their drugs are all in the formulary. You've done all the hard work already, and they're excited about the product that occurred in 2020, and we know the 2021 product is even going to get better. You absolutely have somebody that's of high potential for you to close that person. You want to make sure that you touch them a few times in the meantime, just to make sure that when you do call back during AEP and you do provide the actual product, which you can speak to on October 1st, at that time, you're giving them something that makes sense and they are sticking with you. Left message, obviously, no answer. Disconnected, once again, because the dual market, sometimes it's the wrong number, sometimes it's just straight up disconnected. I can tell you that wrong number disposition goes down when the person calls and says the person's name right away, as opposed to, may I speak to John Smith, saying, hey, John, it's Mike Rose with Diversified. The difference in may I speak to and hey, John is a tremendous difference. They can't get away with, oh, he's not here right now, or they don't get away with those circumstances. You're helping build rapport just by saying, hey, John, it's Mike Rose with Diversified, as opposed to asking to speak with them. And wrong number goes away when you use that start to your call. Not qualified, person doesn't have Medicare Part A and B. ESRD, obviously with 2021, ESRD no longer becomes a concern because the carriers are now accepting ESRD. In the past, we have been able to disposition ESRD so that we can go back on those people and speak with them when ESRD became available. So it was an important disposition for us. Do not call. This person takes me, request that they take you off the list. That matters. It matters a great deal to us. If the person says, do not call me again, I'm done, I don't want to speak with you, you must disposition, and we need to know that so that we can get that person out of the call list. Doctor not in network, obviously not in the Centene network. Language barrier, and deceased. Now, to the right of the column that you're in Google Sheets, you'll see that there's the yellow column, which has the down arrows with the different options of like this. But to the right is a field that just says agent notes. That one we don't do anything with. We don't even upload it back into Salesforce. It's just for your purposes so that if you want to call back on that person, you have a few details on them.
So when it comes to commissions, one of the things we just like to share is, we have our own site, thediv.com/commissions. Takes you right to all of your business issued, everything you're gonna get paid on, everything where you'll see your structure, everything it's all laid out for you there. It does have a caveat though. We actually don't create a login until your first piece of business is issued. It's pretty simple process. Essentially, you get paid when we get paid. We kind of set you up with a login as soon as it comes through. You're able to track it on a weekly basis as often as the commissions get, so as soon as the policies get issued. Knowing that you're going to be writing it October 15th and you probably won't get your first check until January 15th, you probably won't have a login until after the new year, but that'll all be emailed to you. It's pretty straightforward when that time comes.
Communication. It's important to stay in touch with us as we move forward. And there's different ways that we can do this. One is through our conference calls. They're on Tuesday and Thursday evenings at 6:30. As AEP does approach, those dates might change. We might add a different call in there just to be available to you in the mornings, if that helps. You'll find out more details as we move forward, but know that there's a Tuesday and Thursday call. It's at 6:30. It's the same login information that you use to get on this call. It's always the same frankly, we've done that intentionally to make it easy for you, so you're not trying to find the number every single time. Stay in touch with your manager, your coach. Some of you work directly with Steven. Some of you work directly with us. Some of you are, different ways. Whatever the case may be, communication is key, especially during AEP. Don't get in a spot where you feel like you're left out there high and dry and we're not helping you. If you're in a situation where you need help, we're all available to you for a purpose. Whatever you need from us, we're going to go. If I can't get you an answer, then I'm going to get the right answer, and the vice, and that goes for every single one of us. We'll help you get the answers that you need. Our phones are blowing up at all times of the day during AEP. WhatsApp. We highly recommend that you download WhatsApp. I can actually, as soon as I'm done speaking, I will place inside the chat a link, which will give you a link directly to our WhatsApp discussions. One of the things that's been helpful about WhatsApp for us is that agents are able to go directly into WhatsApp and just ask a question. And then any other agent can support them. Any other agent can help them. We don't have territories. We don't have a culture that pushes down. One agent is sitting there fighting for a spot that another agent could have. We help each other all the time. And generally, when you put a question in WhatsApp, another agent is going to be the first person to respond. So we highly encourage you to get involved with WhatsApp. Just get in the chat, and there's also guys that are in there. So it's not discouraged. It's not encouraged. It's just the way that it is. Some guys place their apps and say, "Hey, I just sold one. Just happened here. Or, I just did this." And some people just do that every time. Some people don't ever do it. Whatever you feel most comfortable doing, we want to support that. So if you want to put your apps, when you do have a sale, put it in there, and you'll see others will kind of applaud you for it. So we encourage that. Follow us on social media. It helps us to be able to get information out as fast as we can. So when something happens or something we need to tell you about, if you're following us on social media, we're on all different platforms. We're on Facebook, we're on Instagram, we're on Twitter, we're on YouTube, we're on LinkedIn. We also have a blog that generally is placed out there once a week. We just discuss some topic that might be of interest to you or to your clients. I'm actually going to pass this now to Anthony, who's going to share a little bit about our most successful agents' tips.
So we went to the agents and we said, "Hey, look, now that you're doing this for a while now, if you had a brand new person that was coming on start, if you were a brand new person and you were starting, what would be a tip that you would like to hear that would be something that really would have made a difference for you from day one when you first started?" And we had a slew of these things. The list just went on and on to the point where we had to kind of stop the conference call and say, "Okay, guys, we had enough." We went through what we heard the most from people. And this was kind of this little list that we put together. Everybody has pointed out that the double tap system works. Now, some of you may have done this in the past, but most people don't do it. So let me ask you all a question that you could kind of think about. If someone were to call you right now and they call you from a number that you don't recognize, you look at it and you say, "I don't know who it is, I'm not answering it." And then immediately after that phone stops ringing, it rings again with the same phone number calling you. What's the thought that comes to your mind? Anybody?
It's important.
It's important.
They're calling back to see who is calling them.
That's what I would think.
It's a matter of who this person's really trying to get in touch with me. This is important. Mm-hmm. We call that the double tap. Most telemarketers, when they call somebody and they don't answer, they're on a dialer system that does not allow them to call back again. So because of it, they're not accustomed to a telemarketer calling them back-to-back times. So they immediately think this is something that's important and this person is trying to get a hold of me. And the bottom line is, you're not a telemarketer. We're not telemarketers. We already have an existing relationship with everybody that we're calling, whether it's because they sent us a lead or whether it's because they're our Part D member. We have an existing relationship with them. So us calling them back a second time immediately, you are going to find an increase of approximately 10% in your answer rate, which is huge, guys. If you make 100 phone calls today and you can get an additional 10 people to answer the phone, it's gonna equal sales. So I realize that this may be a little bit outside of your comfort zone. I think it is for everybody the first time that they do it. However, it works. It absolutely works. And the bottom line is, if you're not speaking to people, you're definitely not getting sales. So you want to do whatever you have to do to get them on the phone. So you call them, you hang up. If they don't answer, you immediately dial the number again and call them right back. You will be shocked how often the phone gets answered when you do that. And we have yet to have an agent who's done it who said it doesn't work. Every agent has said this works. And this is what we've been doing in our call center for a couple of years now. Answer rates are higher when you are calling from a local number. So we have purchased multiple phone numbers in local areas. And if we don't have any in certain areas, then we'll do what we have to do in order to get those local phone numbers. There is a local number info sheet. I can't click on it myself, but can somebody pull that screen up?
Yes, just give me one quick second.
So what you're going to do is, before you dial the phone number, you are going to hit pound and then...
Can you guys see that?
Yep, and then that number. So for argument's sake, let's say you're calling the Brooklyn, New York area, for argument's sake. Before you dial the phone number, you're going to hit #1, and then you will dial the phone number. That number in column C there is the number that will pop up on their caller ID. So it looks like it's a more localized phone number. So you have it in there for, we have many, many areas here. So if you're calling Fairfield, Connecticut, Rob, you're gonna hit #29, and all of a sudden the 203-480-0446 number will pop up. Now, if they were to call that number back off a caller ID, it will ring into our main line. When it rings into our main line, we will take that phone number that's calling, we will look it up in our system, and we will be able to tell that it was Rob that just called that number, and that call will get transferred to Rob.
And
So
that's inbound calls happen that way?
I'm sorry, say that again, Rob?
So let's say I've done that, and I've done the sales pitch, and I now need them to call me to enroll.
You should give them the 800 phone number. You should give them the 800 phone number for that.
Okay, fine. Okay.
Yep, with your extension. People feel a little more comfortable sometimes when they get an 800 phone number calling back in.
Dumb question, but I don't know what 800 number and extension I would give them. Will that come to me at some point?
Yeah, great question. Is that that's not actually on the script, is it, guys?
It is on the script. I'll share it right now. I just gotta get it open. It's 800 right here. It's actually all over the script. Right here. Can you guys see the screen?
Yeah. When we're telling them to call us back, I was just thinking. Yeah. I think it's actually the other script, Dan, where we're the sales script at the end where we say, "I need you to call back." I think it actually just says, "Call me back at Diversified Health." Yeah, that one would be like almost the last page.
So which 800 number is it? Is it the one that's in the chat?
Yep, same one.
Okay, so that's for enrollment purposes, right?
That's the Diversified 800 phone number, period. It's not a special number for enrollment. Now, with that said,
going to be improved along the way. Some of these things, we're going to see some, provided that the system, we go forward with this decision, you're going to start to see a lot of these things happen even easier. So don't get too caught up on this, because some of you aren't even going to get on the phone in the current environment. So.
But Rob, your question, if they were to call back the number that's off the caller ID, it'll still go to our main number. So that it could also work as well.
So at some point, I guess I and everyone would get an extension on the 800 number to share with the client to call back.
That is correct. That is correct. And whether it's the 800 number or this number that they call back, because this gets forwarded to the 800 number, which gets forwarded to our main number. And then, the extension works within our phone system. Do not skip this step, guys. There's a reason why we've invested in buying all these phone numbers and programming our phone system with all these pounds. It works. That's the reason why. We have found agents say that they've skipped this step in the beginning because they were so busy learning everything else that was happening. It was, it's okay to skip this. Do not skip this step. You will see a considerable difference in the people that answer the phone when it's a local number versus a number that's out of state or non-local. You'll, again, think about what you mentally do. Aren't you more open to answering a localized phone number versus a number that's calling from a different part of the country when you don't recognize the number? So it works. It works. Okay, let's go back to that sales tips. Any questions on this at all?
What about calls after office hours?
So if a call comes in after hours, then they have to use your extension because there's not someone that's answering it. If it was calls that you were making after hours on this system, and there's no one there to look up the phone number, that's something we're going to have to just deal with right now.
Hopefully the new system, and I hate to talk in kind of hopefullys, but every company that I'm speaking to at this point will incorporate, if the person calls, Jeff, if you were to make the call, the system would be intuitive enough to know he made the call, it's going back to him.
Thanks.
All right, are we good there? All right. Be sure to ask who else in the house is on Medicare. There's no reason for you to leave applications on the table when you may be speaking to someone whose wife is sitting right there and can also qualify. Make sure you're in the midst of your conversation, ask about the spouse. Ask if the spouse is on Medicare. Is there anybody else in the house on Medicare? We get referral sales like that all the time, and it happens a lot of times in one shot. So no reason to not leave a call with two sales instead of one. I mentioned this yesterday. I think I mentioned it this morning. So it's a numbers game. The more you dial, the more sales you will have. Everybody will tell you this. It's no different than any other salesman you've ever done. You cannot sit there and say, I haven't had success, and then we look at the number of calls you made and you made 10 phone calls. You need to make sure that you're making the phone calls. It is a numbers game. Nicole mentioned yesterday, you know more than they do. The bottom line is you are the expert here, and you do know more than what they do, and always remember that, and that's going to come across in the confidence that's coming across in your voice. Messages. Messages are working for us. When you're not getting them and you're getting a voicemail, being able to say, Mrs. Jones, this is Anthony Rose calling on behalf of WellCare. We are your current Part D prescription provider. Giving you a call today because there may be some additional benefits that you are not taking advantage of, such as dental, hearing, and vision. Please give me a call back. You can go as informative as that. You could go as informative of, this is Anthony Rose calling on behalf of WellCare, your current Part D prescription provider, needed to speak with you. Something as urgent as needed to speak with you could possibly work. People do different things, but the bottom line is most of our people are leaving messages. Not every time they call a person, because you're going to call a person 10 times if you have to, but they are definitely leaving messages and getting some callbacks. Staying with the times and discussing current climate. Mentioned this yesterday in your introduction script, talking about what is happening right now with COVID and how are they doing and how are they handling it, and are their grandchildren going to school right now, or are they studying at home, or whatever it is. But discussing the current climate works. When we say current events, stay away from politics. I think everybody here knows that. It's hard to know what side people are sitting on, so don't get yourself in trouble. Obviously, all of you are salespeople, and you know the quality of questions you ask will determine the quality of agent you are. You need to make sure you find out what they need. You need to find those hot buttons. We discussed those hot buttons yesterday. You got to make sure that you're asking the proper questions so that you know what is important to them. As I mentioned yesterday, if they don't care about vision benefits and all you keep talking about is how great the vision benefits are, you're not going to go anywhere. You're not going to get anywhere with it at all. When you find out how many times they go to the doctor a year, that's going to help you figure out is this doctor really important to them or not. You got to make sure that you're asking them questions. Also remember that the person who's asking the questions is the person that's in charge. So that'll get you, that's important there. And then lastly, participate in every conference call. It's every Tuesday and Thursday. It's at 6:30. Get on it. We'll talk about what's happened for you. You'll hear what's happening for other people. Sometimes the conference calls are a wealth of knowledge. Sometimes you leave the conference call with one thing that you were able to pick up. If you're able to leave every conference call with one little thing that you can do or change, or that you forgot, it was worthwhile for you. It was successful at that point for you to do it. So we urge you and we expect you to be on the conference calls.
When do they start? Are they going on now, or they start after AEP?
Oh yeah, we do those every Tuesday and Thursday night. We have for 5 months now. Sometimes we have 10 people on it. Sometimes we have 20 people on it. The goal is to keep it to a maximum of an hour. A lot of times they're 40, 45 minutes. But we say earmark from 6:30 to 7:30 to be on the call. Most people are not video. Most people are just doing it from their cell phone or whatever it might be. And we call on you and say, hey, what happened today? The purpose of this is not to micromanage you. The purpose of it is to make you successful. Obviously, the more successful you are, the more money you make, the happier you are. The happier you are and the more money you make, the better off we are. So it's a team effort here on what we're doing. And yes, they're happening on a regular basis now. Again, like Mike said, it's the same call-in number you used for this. There will be one tonight at 6:30. So yeah, we'd love to have you all on. Any other questions on the tips from the most successful agents? Okay. This page right here, guys, is something that you should look at more than once because you will remember the different things. But you got to double tap. You got to call those local numbers. You got to make sure you're asking who else is on Medicare. You got to make your phone calls. You got to make sure that you're asking all the questions, and you got to participate in the conference calls. Okay, next slide. Our client website, just to kind of give you an idea, from the consumer perspective, we use theroseboys.com. This is something that we have a radio advertising on the Rose Boys. We have a little jingle that's out there playing. It kind of helps with some branding and some name recognition. And it does help so that people are feeling like they're not dealing with a Goliath of a company, and that they're dealing with people who actually, a family organization that actually cares about what plan they're going in and that they're getting their benefits. So at any point you want to check out the Rose Boys. I'm going to forewarn you now, all right? And you can't say that I did not warn you of this. When you go to theroseboys.com and you go to the bottom and you click on the jingle for the Rose Boys, it is going to stick in your head like one of those songs that you just cannot get rid of out of your head. And you're going to be walking around singing this jingle. So I'm forewarning you of it because it's that catchy of a jingle. But it's still pretty cool to check out. Go ahead, next slide.
I just want to let you know, I get a link, I get a text every single time somebody goes to our site, and one of you just hopped on it.
This is actually the last slide here, right?
This is the last slide. Okay. All right. We are right on time here. So first thing I have for you is, do you have any questions? I know we hit you with a lot. Everybody's good. Okay. So our next steps here then are, we have to figure out where everybody is at. What you've gotten done, what you haven't gotten done, how to coordinate our next steps as far as getting your phone, as far as all of those other things. Those are the next steps on where we need to go. Biggest thing is we got to make sure your contracting's done, your certifications are done, all of that good stuff is done. If you're doing field agent certification, we need to switch you over to a teledigital agent from the field side. Some of you may have been contracted just as a teledigital agent strictly, which I am not sure that that's the case for anybody that's on this call. So there's a lot of individual circumstances, but the intention here is to get you all rocking and rolling within the next 2 weeks here. Now, we need to get, remember that for October 1st, you could start talking about new benefits. You cannot take an enrollment at all. Prior to October 1st, you are not allowed to discuss any new benefits. It's against CMS regs. But, you know, you start teeing them all up so that on October 15th, you're literally taking inbound calls for enrollments because you've teed them up from October 1st to October 15th. We anticipate that the first couple of days of AEP is just going to be absolute madness of all of the enrollments that were set up in the previous 2 weeks. So, and that is all I have. I want to throw it out there to anybody else from the executive team that may have anything or any questions from you guys. So I'm just going to open the floor up right now for a minute.
Is this the end of the telesales training, or do we have to register for the other dates that were listed?
No, you do not have to. We're doing the same training those dates. There's so many people in the pipeline at different phases. That's the reason why we're doing multiple trainings. But no, you do not have to go into one of those other trainings. Now, we are going to be, and again, you'll get this communication through the WhatsApp, but we are going to be rolling out the states that we missed the other day in the summit early next week.
That's
hopefully.
right. I forgot. Okay.
You know, and then join the calls. Now, one of the other things is we will have you do some role playing with either Jeff or Akram. Once we've got you ready to rock and roll, that way it's super fresh in your mind before getting on the phone. So we are not looking to micromanage anybody, but we are looking to hold your hand, if that makes sense. We want to help you. We are not, and I would hope at this point that everybody picked up on this, but we are not an organization that is looking to give you a box of supplies, a pat on the back, and say, go get them, Tiger. We want to be able to help you become successful and support you in any way that we possibly can in order to do that. That is our goal. That is our intention.
I'm going to jump in there for a second. I know you put a lot of importance on these Tuesday evening calls, but it can never be stated as important enough. These Tuesday and Thursday evening calls are your training from this point forward after you're now done with your initial telephone sales training. The information that comes out of these Tuesday and Thursday calls, the sharing, okay, that you guys are giving to one another, we pretty much questions, okay, but what you guys share, anybody that you'll talk to that's been on these calls, okay, it's not a rah-rah sales meeting, okay, it's information, and it's about helping so that you can get to the next step, so you can increase your sales, so you could positively impact lives. So take advantage of those Tuesday and Thursday calls. It's an hour, okay, on each of those nights, but take advantage of them. You're going to get so much more out of it than what it's going to take you to put into it.
Well, is there also a cell phone number for those Tuesday and Thursday night calls instead of the Zoom?
Yes, it is the same. Oh, I see what you're asking. The call in. Mike, do you think we could repost that one?
I'm going to put it right on the screen right now. Just give me 1 second here. I'm not sure if you guys can see that, but it's actually
The phone numbers.
the
not
actual
there,
phone
though.
numbers. I'm sorry. I got the ID and the password, which you'll need as well.
Yeah. Yeah.
And
Not a problem. Give me 1 second and I'll give it to you.
That's a storm.
yeah, that's just the Microsoft backdrop.
You need sunshine there.
Definitely right about that.
Hey, it's in the chat. Well, it's going in the chat.
There we go.
Last thing I would just add real fast. Is there any feedback? Can we have done a better job? You know, we're running these meetings every Monday and Tuesday for the next 3 weeks. This is probably our 5th or 6th one that we've done since COVID. And, you know, it's a little smoother each time we do it. But is there anything that you can say, hey, listen, you know what? Why don't you try it this way? Or can you possibly next time you do this, focus here? We'd love your feedback, and we want to make sure that we're on our game as we move forward. So anybody have anything that you'd like to say, make sure you do it this way and continue that way, or maybe change it up here? Okay. Well,
Mike, those
asking
phone numbers you just posted, sorry, did you post 2 phone numbers there? Well, I see a 312 and a 914. Are those 2 separate call-in numbers, or what are we looking at there?
That is the meeting ID afterwards, after the phone number. So the phone number is the 312-626-6799. If you copied and pasted this into your contacts and just click on that, it'll automatically enter the meeting ID for you. That's what that one tap mobile is.
I see, with the 2 commas.
Right. If you just copy and paste it exactly like that into it, then it'll work.
Yeah.
Then it'll work so that you don't have to enter anything in. Works pretty cool actually.
How do you copy from a computer to a phone? You see what I'm saying?
Me personally, all right. So first off, we'll post it in WhatsApp as well, but we have to get you into WhatsApp for it to appear for you.
Okay.
But me personally, I would copy and paste it into an email it to myself, open the email on the phone, then copy it into my contact. That's how I would do it. But I don't necessarily do things the smoothest way. I make it a little more difficult than I have to from a technology perspective.
So the meeting ID number is the 914, and then it says number, and then it says comma, all that other stuff. You got to put that all into the phone, and it just looks like
you put that all into the phone number portion of the phone, so that when you say the call, what the commas are those are pauses, so that it's waiting X amount of seconds before it actually does it for you.
Okay.
That's what the one tap does. But
yeah, this is
again,
senior. It took me 30 phone calls to try and figure out how to work this. So play with it, take your time with
it. But it shouldn't. If we get you in WhatsApp, and Mike just put the WhatsApp invite, if we get you in the WhatsApp portion, you'll be able to click on it right from WhatsApp, and it'll open and it'll just dial for you.
Right.
There's 2 actual invites to WhatsApp. There's 2 different kind of chats that we use. One is strictly for the sales side on the phone, and the other side is for just part of like what we do. I'm sorry.
Yeah, there's two.
There should be two. I only see one on my end for some reason.
Yeah,
So
there's
those
two.
are both there for you, and you can use those to help through. And I'll have if you're having any challenges, Gabby's the person to go to. Extension 841. I'll put that in there right now as well. Gabby can help you through all of these challenges. That's what we. Sorry, typed that too fast. There you go.
And anything else anybody wants to hit? Any questions, any thoughts, concerns, excitement, anything?
Yes, maybe this is an individual discussion, but how do we evolve to focusing on particular geographies?
They are individual discussions, because what our intent is to figure out where you're going to try to go, and then make sure that we can support it there with leads. You know, we're getting leads in 23 states, and we want to make sure that not everybody wants to go to 3 of those 23 states, and then we can't get them worked. We're purposely telling everyone not to get licenses yet in states until we know for sure that we could support it there in that state. So you're right, it's an individual conversation that we got to have with you. I think Mike is in the process right now working with Dominica on figuring out the numbers as far as the leads that we're getting in the states and the amount of people that we have that are licensed in those states already, and so on and so forth. Obviously, we don't want to create cost for no reason on, telling you to go get a license in 4 states that you're never going to work in. So. Anything else? All right, then with that said, folks, it was a pleasure working with all of you over the last 2 days, and wish you lots of success, and look forward to speaking to everyone and moving you all along to the next step very, very quickly. So wish you to have a great day today, and I'll speak to everybody real soon.
Look after you guys. Have a great day.
Very much.
Take
Appreciate
care,
it.
everybody. Bye-bye now.
Hi, everybody.